Thank you very much for joining us today. This webinar titled Implementing Health Education Strategies to Address Tobacco Use Among Agricultural Workers. I want to present you our speakers today. Our colleagues, Olivia Antonio, she is a Farmworker Health Training Coordinator here at NCFH. And with us is also Esli Reyes. She is the Health Center Training and Technical Assistant and Partnership Manager. Okay, then, and with that, I'm gonna pass it over to Olivia, who will be our first speaker.
Thank you, Alexis. Welcome, everyone. My name is Olivia Antonio. And as Alexis mentioned, I am the Farmworker Health Training Coordinator at NCFH. And today we will be learning a little bit about tobacco implementation. And some learning objectives to go over is um, this webinar. In this webinar, we will be learning about tobacco use among migratory and seasonal agricultural workers and how it impacts on their health. We will also identify key risks and challenges that contribute to the use of tobacco among themselves. And lastly, learn key health education strategies and best practices for effective tobacco health education for themselves. So some information on themselves and tobacco use. Tobacco is a plant that contains nicotine, which is harmful and very addictive to the body. And it comes in different forms, not just a leaf, but in liquid forms as well. Smoking and vaping harms both the user and those exposed to secondhand smokers, such as an example, if a MSA worker is smoking around other colleagues, they're more likely to be exposed to secondhand smokers or around family members as well. Results across data collection methods have suggested a common reason MSAs use tobacco is to cope with stress or mental health issues. And also stress, anxiety, habits, social situation, and nicotine addiction also makes it harder for MSAL workers to quit smoking. And in 2022, about 14,600 agriculture workers who visited a health center were identified as a tobacco user, which is a big number. So why is tobacco education in need among MSOPs? So there are many reasons why there's a need in education among MSOs. One of them is to raise awareness about the impact of tobacco use on their health and well-being. We also want to help debunk some myth about tobacco uses. For example, depending on where they're from, tobacco use may help with sickness or other things that they have beliefs on. Also support preventing health complications to help themselves have healthier lifestyles. We want to make sure that they're living a better health style life and making better decisions. Also reduce the tobacco smoke rate among MSOs, including youth, pregnant women, and caregivers, as it has also impacted pregnant women when consuming tobacco. As mentioned, so it has been tobacco use has become very common on MSOs workers, and not only are they being introduced to cigarettes, but also other tobacco products such as e-cigarettes, chews, cigars, cigarrillos, which are small cigars, heated tobacco products, and snows. So there's several different types of tobacco um, products that has been made out of tobacco. So, some things that we have seen among MSOs using tobacco, they're more likely to develop health conditions such as lung cancer, blood clot, diabetes, chronic obstructive pulmonary disease, gum disease, tooth loss, which are some of the common ones. There are other common health conditions such as reproductive system as well. So it could affect trying to um, prepare yourself to have a baby. You could have some maternity problems as well. And then job and daily performance. It can make it hard with breathing problems, being fatigued, increasing anxiety, and decreased concentrations, which can lead to more sick days or missing work due to health problems. So all these tie into the use of tobacco. Mm. And some more information on tobacco use on IMSAL. So early exposure to tobacco is very common, such as in your youth or infancy, and can cause infertility problems. Again, like I mentioned earlier, you have a higher risk of developing nicotine dependency, leading to continued use of tobacco products into adulthood. And then for some examples of what can happen if being used by a pregnant woman, it can cause premature birth, can also develop risk of stillbirth, some complications during labor, a poor fetal growth and low birth weight of the baby, some damages to the baby developing of lungs and brain, and lastly, sudden infant death syndrome, or more commonly known as SIDS. And some benefits of quitting tobacco that can help our MSO workers is quitting tobacco could help them save some money and have more income in their households, um, which means they'll be working more and having less sick days or possibly missing less work from missing less days from work. And also, it can help them with having less risk of developing any types of cancer, stroke, heart disease, and breathing problems, and can help them work better and be able to walk more during their labor time, work labor. Also, it can cause less coughing and have healthier lungs. Um, Again, have less shortness of breath when doing daily activities, making it easier for the workers in the fields, and also have a less risk of secondhand smoke exposure for their households and also for their work members when they're at work. So now we're going to talk a little bit about some unique risks and challenges that are sometimes faced by some is from the themselves. I'm sorry. So some common challenges that we have seen that has come that MSOs face are sometimes education access and quality, so limited formal schooling, low literacy levels, economic stability, poverty, lack of employment benefits, social and community contexts, community and workplace barriers, limited work protection, lack of awareness challenges. So meaning that sometimes depending on their low literacy levels, they might not be able to understand some of the information on tobacco use. And also language barriers can occur as well, as some may only know Spanish or only know their native language. Again, like mentioned previously, healthcare access and equality is a big one. So most may not have insurance. They may be limited to understanding how the healthcare system works. And also some, again, they have their own beliefs and traditions on tobacco uses. And depending on the area that they live, maybe healthcare may be limited in their areas as well. Another challenge that we have seen that MSOs have faced is lack of transportation, not being able to get transportation to go to a health center. Um, and also, there might not be a mobile health transportation system in their area as well. Poor housing conditions and food insecurities. And as mentioned earlier, we have seen communication being a big challenge for MSOL workers as they are limited to English proficiency. Um, Tobacco resources are not often in their native language again. It may be just available in Spanish or in English, which makes it harder to obtain the right information or maybe easily misinterpret. Um, Also, we've seen how children's of the themselves workers are being performed as interpreters, which should not be used as interpreter for themselves as the information can be misled or have errors in health communication and yeah, provide the wrong information. So at the National Center for Farmworker Health, we do have some language interpreter agencies that we work with, and these agencies help provide information and information according to their um, native language, which Alexis has linked the link on the chat. And when providing translator information or interpretation service to MSODs, it is recommended to utilize qualified people to ensure the correct delivery of the message in the patient preferred language. So, meaning that it's recommended to use these services um, with MSODs and so that way the information can be as accurate as it can. In other words, not using the children as their interpreters whenever they go to the doctors or also again us healthcares and organization making sure that the language is um, delivered in a mannered way that they can understand. Um, so So feel free to use the information that is linked and use these interpreters agencies as they can provide a lot of support and help when it comes to doing interpretation or translating any documentations um, for themselves. And now I'll pass it on to my colleague, Ashley.
Thanks, Olivia. Hello, everyone. Again, my name is Esli Reyes, Health Center TTA and Partnerships Manager here at NCFH, and I am so happy to be here. This is one of my favorite topics, and health education is also my passion. So this next section, we will focus on some strategies and best practices for effective tobacco health education for MSAWs. We're going to briefly walk through some practical approaches that can strengthen tobacco health education efforts within your agricultural worker communities. So let's get started. Next slide, please. On this slide, we are defining health education for MSAWs and what it should accomplish. We know that health education should focus on providing learning experiences on health topics. For example, today we'll focus on tobacco prevention and cessation. And it's about helping people gain the knowledge and skills to make healthier choices. And this is what it's all about, that what they see, what they hear, what they learn from these educational resources actually motivates them to take action to be healthier. A key point is that health education must be adapted to the audience that we're serving, right? It is now one size fit all, and we will learn through some of the steps that we will see today. But we need to take into account their language, their customs, their habits, and real life working conditions, and take all of that, put it in a health education resource that resonates with them and will speak to them and actually motivate. We can see here in the diagram on the screen, an effective community health education should have the following elements. It should be inspiring, it should model, it should be realistic, readable, relevant, and my favorite, it should be relatable. People should be able to see themselves in it, right? What can happen to me? How can it affect my family? So the message truly connects and can be applied in the daily life of agricultural workers. So today, next slide, please. Today, we will talk about 10 different steps to develop community-based materials. You can see all the steps here on the screen, but we will go over them in the next few slides one by one. So buckle up, let's get started. Next slide, please. For step number one, and one of the most important steps, is the community input on health education resources. Here we start by focusing on understanding the tobacco use patterns and needs within the community that we are serving. How are they using the tobacco? Who is using it? What kind of products are they using? It's important that we understand. Because when we think about making this health education relatable, we need to make sure that it reflects things they do and see and go through in their daily lives. So, to get a good context of the community, CHWs and outreach workers play a key role here, since they often already know what gaps exist out there in the community, what topics are more relevant. It helps to communicate what kind of aspects of health education we need to include in different formats that we will learn later. Um, and it's important to also review what resources already exist out there, right? We for what's available rather than duplicating any efforts. And as we can see here, one important aspect is to input from the community. And we do this at NCFH through, we do outreach activities, we do some surveys, we do focus groups, and we want to learn what are some of the challenges. We do this for different health topics, but specifically for tobacco, we want to learn what age groups are using different products. We want to learn what are some of their worries. Is it them? Is it affecting their family? Is it affecting their job? And what we do is get all that input together, and then we can reflect it in health education that actually is impactful for them. And when we think about reviewing what already exists, sometimes in these focus groups, we will bring some of these resources and show them and say, hey, what do you think is missing here? And from there, we're able to build and expand that health education and put it in new resources. And yeah, overall, here in the community is always where we want to start, because at the end, these resources are for them. We want to make sure that they are the grassroots of whatever we are implementing. So we can go to the next slide, please. For step number two, create health message. The focus is again on developing one clear and simple key message about tobacco use and prevention. Here at NCFH, we always repeat this. Everyone benefits from low literacy, from messages that are easy, clear, and simple to understand. we serve different audiences, from agricultural workers to health center staff to leadership board members, but everyone really benefits for simple and clear language, right? Specifically for these materials that are directed to our communities, the message should be concise and easy to understand. We always avoid any jargon, acronyms, or advanced medical terms. Again, it should resonate with our community members. I did mention that relatable was what my favorite, but it's one of the most important. Making sure it connects to their experiences, daily lives, and it reflects their values, customs, and practices. For example, some of our resources that you're going to see later in this presentation, we use some liners like, "It's never too late to stop using tobacco." Or, "Did you know tobacco can make you tired while you're at work?" And these are liners that are simple, but we know they're relatable to farm workers, to agricultural workers, and they're more inclined to actually open a brochure and get to learn more about it. And we're going to see more examples throughout this presentation, but this step is very important when you're thinking about the health message, because it ensures that the tool, the resource, or any format that you're doing on health education actually achieves what is designed to do, which is educate and motivate a change towards a healthy life. And we're going to see some examples of health messages later, but it's a very important step on this 10-step um, journey or plan. Next slide, please. For step number 3, and this, I'm going to refer back to what we just heard from or learned from Olivia. One of the important step when we create health message, well, we know that not everyone we serve speaks English, right? So identifying language spoken is very, very important, because especially we have seen that agricultural workers speak many different languages. They also, many MSAWs have limited English proficiency, so it's essential to first understand the audience that we are educating, their location, preferred language, and we're going to talk about formats in a couple slides down, whether they have inability to read, then we think about formats, right? Do we need audio, visuals, etc., to guide how the message is delivered? And if needed, it's important to work with certified interpretation and translation teams to ensure the message is accurate, accessible, and appropriate for the community. Later, we're going to learn about a strategy that we implement here at NCFH to help reflect and respond to all language needs, such as indigenous languages, and how we do it and incorporate it into our health education materials. But yeah, step number 3, we identify what languages, and I'm going to just backtrack a little bit. First, you learn about the community, then you think about a health message that resonates with them, and then, okay, that health message, okay, resonates. What are the languages that my community speak? And we're right here. Now we're going to jump into step number 4. Next slide, please. On step number 4, like we mentioned on the last slide, we identify the message format. We know that health education comes in different ways, in many different ways. We here at NCFH also use a combination of either written, visual, and audio formats. And we have seen that using this combination of different methods have ensured that materials reach a wider audience, a wider range of people across different communities. It also is important when we go back to learning about the community, and when you do focus groups or even CHWs informing your organization that is developing this resource, it's also important to learn, right? What formats are more effective for their needs. And as shown in the graphic, we can just see some examples, and some, I think, over the years, either learning from other groups and being in the community, we've also have learned about very creative ways to educate. So, for example, we have image-based prints such as flyers, posters, booklets, brochures. We're going to see a door hanger as an example. We also have audio, radio novelas, PSAs, images with audio that we include. You're going to see an example. And then we also have videos, voiceovers, infographics with video, etc. And all of these are different formats that you can incorporate tobacco education to really reach your community. And I would like here just to stop for a brief moment and ask a question, and you feel free to answer in the chat, but do you use or have you seen or your team any of these creative methods being helpful in your own communities? I'm just curious to see, maybe you know any others. The door hanger, we're going to talk about it later, but we've gotten really good feedback from CHWs working, specifically learning that farm workers, agricultural workers work different hours during the day. So sometimes the education is right by the door. But just curious, feel free to get the chat going with some of your creative methods of health education. We can go to the next slide, please. All right. So here we can see I've been referring to a door hanger. This is one of our resources on created by a great colleague here. And this is one of the resources that we use for tobacco. And as you can see, it is a door hanger. This is a printable. It cuts in half, English and Spanish. But you can see some of the liners that we talked about. We try to get their attention by having images that reflect themselves. We have liners that are how it can affect you. It's never too late to change. And when I go back and talked about how focus groups and learning about the community and CHWs communicating what are their needs, how that shapes, you're going to see that we found that a lot of people probably don't understand what is tobacco. So we start this resource talking about this is very briefly, I think it's 2 sentences, what is tobacco, And then we learned about what is the most common products that they use. And you can see here in a quick table, and we try to include images that are realistic and that they can identify them. We also learned that a lot of youth, specifically agricultural workers, use vapes. And a lot of them thought that because they come in fun flavors like strawberry, chocolate, watermelon, they're less risky or dangerous. And we, in this quick resource, we talked about it and we say, hey, vapes are not better, right? And sometimes there is some data that shows the other way. And we also talked here very briefly about some health impacts that they can have from cancer, heart disease. And then one thing that we have learned across many, many conversations with agricultural workers and our work with them is that for many of them, the most sacred thing is our family. That has really impacted the way that we transfer health education to our agricultural workers and families, because family is precious. We've even heard from some agricultural workers mention, like, it's not about me. I don't care about me, but my family. So you're going to see in the back, which is the green part of these door hanger, that we try to incorporate an element of their family, like actually smoking or using tobacco can affect you, but can also affect those around you. We use the word family purposely, knowing that it's going to resonate whoever is grabbing this door hanger and trying to learn about tobacco. And another thing that we also translated to from knowing the community that we learn is that a lot of agricultural workers also value a lot their work. They count on their paychecks, they count of their it's part of their income. They don't want to lose money. So we know that it's also a very important part that that could, motivate them to make a change. So you're gonna see that in the back of this resource, that we also include, hey, if you make a change, and we don't never say like make it today. We know that it takes time, and we encourage to make them, but you're going to probably save money. You're gonna probably have less days of missed work. You're gonna feel better. You're gonna have don't have shortness of breath while you work. Get less tired. And we start talking about all the benefits, right, about them. We always encourage them with a call to action, and then we have some of our resources. to connect them to a health center that they can help them through the journey of quitting using tobacco. And this is just a quick example that I wanted to go over, and I did it midpoint because right now we're going to go through the next of the steps where you're going to see the importance of adding audio, visuals, design, and how that impacts health education. But at this time, you also have a QR code. I invite you to also visit our website where you can actually see more of our tobacco education resources. And again, feel free to also use this door hanger in your communities. Next slide, please. All right, so step number 5, we talked about translation and interpretation. We just talked about how knowing their language is important. We talked about how messaging is important, just looking at the flyer as well. But one thing that we have learned is that it's not what you is not just what you say, but it's also how you say it. The message needs to be delivered in language in terms that people actually understand, relate to, and recognize in their everyday lives. So the focus here is making sure that the message is accurately understood, right? So we know that there's a lot of different technology and systems that can help us translate health messages. But we always encourage, right, that whenever we use translation and interpretation services, it does come from professionals that actually know the community that you're serving, right? That actually are able to test those terms, so we know that it hits home when the health education is delivered. Here at NCFH, we prioritize working with interpreters who are familiar with the communities we serve, and because of that, we can ensure that our translations are not just accurate, but they're meaningful and impactful. We have found that some words that even when it's Spanish only, we do work with a lot of indigenous languages, but when it's Spanish, sometimes my colleague here, Alexis, from Puerto Rico, I'm from Mexico, the Spanish may differ. So this is a very, very important point. And if you don't know who to work with, earlier Olivia did share a directory with some of the organizations that we do work with to get these translations going. Next slide, please. For step number 6, developing audio. This step, we always say, is an optional step, and we just use it when it's relevant to the message and the community. This can be specifically helpful in communities where some members have limited reading skills, as it provides information in a more accessible and easier to understand format. As you can see here, some of our resources that are translated in indigenous languages. The text is translated, the images that reflect the audience are there, but we know that a lot of them might not be able to read. So what we do is we include a read along of the information. So you can see here an example. We have a quick icon, and how we do it is we include QR codes. So these materials are flyers that could be printed out, but there's a QR code where they can scan their phone, look at the images that go along the information, and hear it. So this is a strategy that has been very well received by the MSAWs we serve. And again, it's about knowing your community. If by step number 1, you got to know your community and you know that a lot of them are unable to read, then this is an element that you would want to integrate into the health education that you provide. Next slide, please. For step number 7, develop images and video content. Well, this step is also optional, but I would say highly, highly, highly encouraged, because when we think about everything I've been saying about making it relatable and making sure that farm workers reflect with what they read, having images that reflect them, their family, the field is important because they're able to connect. You remember that door hanger, one of the main images, and I think the main image that we were limited in space, but the main image that is right on top is it's workers in the field. So they're able to know, hey, this health information is for me. It's for people like me that are struggling in the field with shortness of breath because I smoke. So it's important. Um, and we can see here some examples. I also invite you to browse our website and see a lot of more examples of agriculture worker products and how we reflect with images or video. Next slide, please. Um, for step 8, design. Well, it's important to make materials clear and easy to read or follow along. Here we have a social media graphic that we use. You can see that, of course, is reflecting them. It's very simple. The liner is very simple. We, of course, include a little more meat on the post message, but we want that all of our in designing that are is clear, is legible. The fonts are clear. We don't use all caps, right? We also want to use light color backgrounds when we have font. We want to take care of the contrast and basically ensure readability. One thing that we have seen is that when we do either flyers or brochures that are very packed in text, well, they're a little bit harder to follow. So one of the main challenges, I guess, with health education is to try to say a lot but try to say it simple. And the same goes for design. Sometimes we want to include a lot of images, but we might make the resource a little more overwhelming. So it's just important to take some of these tips in mind when we're trying to provide health education. And the last thing I'll say here is sometimes what we have seen is that we have to divide things in chunks, specifically for social media. We can't say everything at once because people are scrolling. So it's something to take. How can we design it in a way that is still impactful, even though we're a little limited to share less information? Next slide, please. All right, so step number 9. So far from step 1 through 8, we've talked about the elements of the health education. So let's say we follow them and we have a good resource, whether it's a flyer, we have a PSA, a radio PSA. Um, and we need now how it started with the grassroots of learning from the community. Now we need to make sure that it's actually working for the community. So we have a step on community review, right? We're trying to test it with the intended audiences, right? We have done that many different ways, directly with MSAWs through focus groups. Also, CHWs are very elemental in outreach workers because they can help taking some of your resource to test it out with the people that they're served, to ensure the message is clear, relevant, and effective before it's widely shared. This is also important to test your translations. You know, you might work with interpreters or translators and you want to test it. Hey, does this make sense? Are these the right terms that we're using? We here at NCFH have an agricultural worker committee where it's composed of agricultural workers from different backgrounds, different places in the country. And we share these resources with them. And the guiding questions, some of the ones, some like the ones that we see here, like what is the main message of this resource? Do you think the information is important for MSAWs? Why or why not? Is there anything missing? You know, is anything that might be confusing or unclear? Is it the message? Is it the images? Is anything offensive? You know, and these insights that we ask them help refine and strengthen our final product. And we encourage as a part of these 10 steps that this is a step that is not skipped, that it could be a small group, but we want to hear from them. And what, based on the feedback that we've gotten, sometimes it's, hey, the images do not reflect. They don't look like me, you know, include this, or you know what? And I think we did get for this resource, the door hanger, a feedback where we had intended to use some clip art or cartoons to show the products, and they wanted to see the real life. So that's like because they have never probably seen what chewing tobacco looks like. So that's the kind of feedback that is so essential and valuable that you can implement into your health education. So definitely a step that should not be skipped, right? And a very important element. Next slide, please. So step number 10 and the last one is dissemination. You have your resource, you heard the community, you tested with the community. So now how do we get it out there? This is specifically important because you work so hard to get a health education, the product that resonates, that that speaks to the community, that has information of a critical health topic that impacts the health and the well-being, but we need to make sure that we're able to get it out there, right? This includes, of course, one of the main ones that you will hear me talked about, because I love CHWs and the work that they do, is that um, we make sure that we share it through trusted messengers, so CHWs, outreach workers, partner organizations that can get there, are important, right? To share it specifically because they know where the people, the MSAWs reside or work. And then another big one is social media, which is a powerful tool, especially when you understand what platforms your community uses, and also sharing with your partners. We have in you will see that we do have a social media toolkit on tobacco education that also encourage, cross posting and helping and working to reach more people with partners and their social media pages. And although it feels that at the moment everything has become so technologized, or technology has a big role, we have seen that printed materials are still important to ensure access for those who may not use digital platforms, specifically for some agricultural workers. So it's about using a mix of channels and knowing your community to see how and what works to get this information out to them. Next slide, please. And as I'm closing this quick section, and of course, we could talk a lot about a lot of these steps, and later you're going to learn about an opportunity to learn more of these in detail, a training opportunity. But I just want to give these final key takeaways when we think about health education. Remember the importance of engaging the community by gathering feedback through focus groups, outreach, and evaluations on tobacco-related resource. Remember to always use clear, simple language and avoid any jargon or complex medical terms. It's important to incorporate visual and interactive elements. You can do diagrams, infographics to help explain the information in a better way. Leverage social media and make sure that all materials are also mobile friendly, because you're going to be able to hit two birds with one stone. You are able to print it, but you're also able to provide it in social media or in technology formats. And most importantly, continuously evaluate and adapt materials based on community feedback and changing needs. We always say that all the products that we do that are health educations are living products that change. So also have a plan in place to make updates that are constant, and time bound, because we want to have especially the best information out there for the people that we serve. And well, everything that we learned today and these last key takeaways really bring us back to the importance of keeping health education community center, accessible, and responsive. And with all that, I wanted to pass it back to Olivia, who's going to close us out and also allow for some questions.
Thank you, Ashley. Um, Well, I hope this was a lot of information that was provided in a short amount of time. I know we kind of went in a fast pace, kind of, we didn't really go in depth, but as Esli mentioned, we will be having some more opportunities on trainings. We do have some small group trainings coming up with one of them starting in May 14th, and we will dive more deeper into the information that was provided today.